Telehealth. Fiber is going to enable it, but what are the applications? Well, we just heard a bunch from Dr. Kumah-Crystal from Vanderbilt here in Nashville at Fiber Broadband Connect. One of the things that you said a couple times is the big idea whose time has finally come. Why don't you tell us what you meant by that?
One of the things that I think is most exciting about the wave of telehealth and innovation we've had during the COVID pandemic is just the concept of necessity is the mother of invention, right? When things kind of all fell apart, everyone came together to stand things up because we realized people had to have the health delivered to them. People had to have care. People had to have resources. People had to be able to attend school. So this idea has always existed. I'm sorry it took something as crazy as a pandemic for it to kind of come to fruition, but it's amazing that just having the architecture and infrastructure in place is what actually helped it to make it a useful resource and tool. There's still some gaps, though, that I think this industry as a whole is working so hard to address so that everyone can have access to it moving forward.
Well, you kind of talked about that. It's the catch-22 situation, right? If you aren't healthy or don't have access to the doctors, it's hard to get healthy, right?
Yeah, and I think that's one of the things that as an industry in health and in fiber and the government, everyone just needs to keep in the back of their mind, because I can admit as a technologist, I get excited about the technology and the cool things it can do and all the possibilities, but always knowing that there are people who might not be able to benefit from it. And by only thinking about how cool it is and not thinking about how it can be inclusive to everybody, you might actually be creating more health disparities. So just being mindful of that and designing with the end in mind that I want everyone to be able to benefit from this is the way to make the biggest impact.
And the whole point of telemedicine is the mobility, right? A lot of people, it's just difficult to actually physically get there, right?
Yes, and I have to admit that we don't have the best parking lot at Vanderbilt either. No, I have patients that I see that are very, very ill. They're like on ventilators, they're in wheelchairs, and just the process of getting them from their house to the clinic takes hours, and they have to have the home health nurse there to help coordinate things. And we do need to see these patients periodically to make sure they're okay. But if we can even extend the amount of time, the frequency of times they have to come to the clinic by having these telehealth touch base sessions to answer questions the families have, to provide resources and recommendations, that could make so much of a difference in terms of the well-being and wholeness the family feels in terms of how they're able to connect with the healthcare system.
Well, and I want to touch on that in a moment. But first, one of the cool things about you is you're not only a professor, you're a doctor. And tell us about a real life example that you just told us about.
One of the fun parts about being a doctor in informatics is I get to use the tools I create. I get to eat my own dog food, I think is the expression. And whenever we're creating some of these tools, like I am an avid telehealth user, and I'm always thinking about, well, how could I make this experience better for my patient? Am I looking at the screen? Am I making sure I'm paying enough eye contact with them as I'm documenting my note? What tools can we enable to have our notes automatically generated so that I'm not looking away to type down the things they're telling me, and I can actually help them feel more engaged? Because unlike in-person visits, there is this still kind of distance that appears when you're having a telehealth visit, but there's so many more opportunities that it provides. Like the concept of like being able to see a family's background, their house, their home, how they live, and the clues that it can give you about how they're going to be able to manage their care is one of these great things that you have to keep in the back of your mind as you continue to design these tools and how they can best apply to other scenarios.
You know, you had a specific example of a diabetes patient.
Yes, as an endocrinologist, I see lots of kids with diabetes as young as infants to as old as 18-year-olds who aren't quite ready to move to adult care yet. One of the patients that I see, and this scenario comes up quite frequently, they had an erratic blood sugar and mom couldn't figure out what to do. But we have these tools called continuous glucose monitors that give us minute-by-minute reading of what the child's sugar is doing, and it's online. I can log in, I can see the data, I can help figure out patterns and tell mom recommendations about how to adjust the insulin, what foods to look out for, whether she needs to do some extra testing, whether she needs to bring the patient in because we've kind of gone too far behind the threshold. And all those things that we're able to do in real time with the mom is amazing, but also makes you realize that some of these decisions can probably be algorithmized, and we can use logic and artificial intelligence and machine learning to figure out how to make these alerts happen even before it comes to the point where mom has to call us. So even before that point, could the mom have gotten some alerts from the device to say, hey, it looks like this is starting to run high, or hey, we're starting to trend high, let's consider this, or even alert me as the provider. So we can elevate the concerns that really matter and hedge off things before they get too late. That's the most important thing about health, being preventative and not reactive.
Yeah, that was one of the things I took away from it was wellness. But one of the other things I took away is just a whole way of different way of thinking things in the future, like the distributed hospital, for instance.
Yeah, I think the way we've been doing health for a long time makes sense for the way health was considered and the way it was established, because we have hospitals, we have care settings, and people came there, and we have the nurses there, and large volumes, we can draw everybody's labs, they all go to phlebotomy. But as things are changing, as people are more mobile, as people are working from home more, it's just worth considering whether we need to meet people more where they are. So Vanderbilt actually has a relationship with Walgreens Hospital. So instead of having to come all the way to Vanderbilt just a blood test, you can actually go to your local Walgreens, get a blood test. They use the same computer record system as we do, so we can see it in the clinic. So thinking about things like that, like why is it incumbent on families and patients to travel all the way to see us when we can have a more distributed healthcare model? As a pediatrician, one of the things I do is make sure kids are growing well, because that's your job as a kid, to grow, to make sure that you're meeting your milestones. So we make sure you don't have some kind of like nutritional problem, absorption problem that's keeping you from doing that. Kids go to school every day. They're their school nurses every day. Can we include them in this care model to help keep track of that, send us information back so that, again, you don't have to come all the way to the doctor just to be seen. The doctor's still there for you, because that's important. One thing I always like as a metaphor is, a week leading up to your dentist visit, you are a very vigorous flosser. At least I know I am. I don't want to throw shade at everybody else. So it's important to have these touch bases with your physician, because it helps you kind of establish your frame of reference about what's important, but also just making that a part of life. Can we be more thoughtful about how to make it so that you're more motivated to floss on a daily basis, and it's not just that 6 month leading up to your dentist visit?
Well, and you talked about that a little bit, the idea of gamification to create better health outcomes, right?
Absolutely, because we know what motivates people. We know what gets people excited. And most importantly, we know that people are motivated by different things. And understanding people, I think, is the most important thing about understanding health. Because if you want to say, I want you to be healthy and stay healthy so you can go to your daughter's wedding, or I need you to take your insulin so you can be the star pitcher in your baseball team, understanding that about people is a way to really get them to do what they want to do, because they're not doing it for you, they're doing it for them. And the more we understand that, the more we can come up with things that can really inspire them, and then using fun technology to make that a little more exciting as well.
And so one of the things, a couple of things you mentioned for looking forward is the privacy of that data. And then for operators, we'll talk to that in a moment too.
Absolutely. The trade-off with technology is convenience, right? The easier it is to do, the easier it is for things to sneak through, I guess you could think of it. But there's so many cool emerging technologies that let you easily interface with technology and interface with data and information simply by using your voice. And I think that's going to be one of the breakthroughs in health, by letting patients talk to their electronic health record, to ask questions, make requests, find out their labs. But people are, I think, reasonably concerned about how their information is going to be treated. And if we can work closely with the people who are developing these tools, work closely with patients to understand their concerns about privacy and to give them honest, full assessments about how their information is going to be treated, I think we can get to a place where they can take advantage of these things that they want to take advantage of, just knowing that we have their best interests in heart.
Well, and some of those tools could even be used to help explain what the doctor just said, right?
That should be just like a default skill. Like, can you summarize that to me in human terms? So yes, just being able to ask questions, follow-up questions, and again, all the knowledge base is there. The thing is just iterating back what the doctor said in a way that you can understand it, in a way that you can communicate it back to your family, because they're going to have questions about how did your doctor's visit go? So being smart enough to train these tools to be able to dissect the patient's chart, to consume the information, and to meet the patient where they are with the information they need so they can make the best health decisions.
So what are your recommendations then for the operators that are here and those who weren't here?
I would say continue to think about how we can get access to everybody that might not have access, or that might have access but it's suboptimal, so that everybody can participate and engage. Because what we find is the more people that are engaging, the more opinions that we are getting, the more ideas we didn't even think about. A lot of the cool innovations that come out that we're able to use actually come out from the accessibility realm for things that are developed for people who can't see very well, can't hear very well, like screen readers. People benefit from screen readers because they're here now, but they're developed for people that had limited access to things. So by bringing those people into the conversations, we can make things better for everyone. So keeping that in mind and not just focusing on the shiny, because I do that too, but also thinking about how can we involve everyone in the conversation so that we can elevate everyone.
That makes sense. It reminds me of a lot of the conversations we're having in autonomous mobility as well.
Yes.
Right?
That's a really great
access and to everyone, right?
Absolutely.
Wherever they are.
Wherever they are, because we're as a country, holistically, the more well everyone is, the more things everyone can provide to making the country better. We want a well population because these are more minds that are engaged in conversation. These are more people that are employable. We want a well population so that we can do better as a society. So I think we're all inspired and driven to do the same thing. I met a lot of amazing folks last night that it's just such a natural thing that comes to them to want to do better for humanity. So that's why I know you guys are just heading in the right direction.
Well, excellent. You're inspiring to me. So thank you very much.
Thank you so much. Have a great day.